we've been working on CAR T cells for decades now. And it's a platform where engineered T cells can be targeted to targets, and that's been a successful approach in blood cancers. But there are a variety of reasons why this approach has not yet been successful or translated to solid tumors. And that is due in part to the fact that there are not as many attractive targets on a tumor like CD19 or BCMA was in blood cancers. And so part of the work looking at a disease like small cell lung cancer, where the prognosis is very poor, was to see if we could identify targets on small cell lung cancer tumor cells. And those targets preferably would not be expressed on normal tissues. And we were very fortunate about 5 years ago, we started working on a target called DLL3. And at the same time, working on another target called GD3. And so what we have been able to do is we first started looking to see if DLL3 would be a good target for small cell lung cancer, and it turns out it is. And we could show this in mouse models, both in immune-suppressed xenotransplant models as well as syngeneic immune-competent models. So that was very promising, but we were still aware of the fact that a lot of these treatments fail because of the fact that these tumor cells don't all express the target. So you get immune escape. And so one of the approaches that we decided to do is to do dual targeted CAR T cells, targeting both DLL3 as well as the second target antigen, which I'd mentioned earlier, which is GD3. And that combination turns out is much better than either targeting one of these targets alone with a CAR T cell. And so we found this to be very, very promising. Now, there's still a lot of other obstacles that we have to overcome with solid tumors, and those include the fact that even if we target two targets, it's still quite possible that tumors lacking both targets will grow out and therefore be a source of treatment failure. And in addition, we also know that if you look at the tumor itself, there are a lot of suppressive immune cells there, and these CAR T cells have to overcome those as well. And so part of what I talk about is the addition of not just doing dual targeting, but armoring these CAR T cells. And when we talk about armored CAR T cells, we define that as CAR T cells that have been engineered to express these receptors that recognize tumor, but additionally are engineered to secrete, for example, pro-inflammatory cytokines. And we can demonstrate that with several cytokines additionally engineered into the T cell so that that T cell secretes those cytokines, can overcome a lot of the obstacles of that tumor microenvironment, those suppressive immune cells. And so what we now have, what evolved from just starting and looking at a good target for small cell lung cancer, we now are at the point where we have designed an armored CAR T cell that recognizes two different targets on small cell lung cancer, so it has great applicability, but can also overcome a lot of the other obstacles that we know exist with this technology in the context of solid tumors. And so hopefully in a year or maybe a year and a half from now, maybe 2 years from now, I'll come back to Naples and present the initial clinical trial studies, because I think we're ready to test this now in patients.